Did you know that your liver is one of the most crucial organs in your body, performing over 500 vital functions? But what happens when it's in trouble? Our liver is like a silent hero, often overlooked but always working hard. From detoxifying harmful substances to aiding in digestion, it's vital for our overall health. But do we know how to recognize when it's struggling? Today, we're diving into a crucial topic: 12 signs that may indicate liver damage. Are you aware of these warning signals? The liver, your body's largest internal organ, is a powerhouse. Did you know that it's responsible not just for detoxifying your blood but also for helping in metabolism, storing nutrients, and even producing critical proteins? But what puts this vital organ at risk? Factors range from excessive alcohol consumption and obesity to viral infections and genetic disorders. Are you exposed to any of these risks without realizing it? But before we dive in, a quick note: this video is for educational purposes only and is not intended as a substitute for professional medical advice or diagnosis. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Let's start our countdown with 1. Fatigue and weakness. Have you ever considered that constant fatigue and weakness might be more than just signs of a busy lifestyle or lack of sleep? Interestingly, these symptoms could be subtle yet significant indicators of liver damage. Our liver, a critical organ for various bodily functions, can manifest its distress through these seemingly mundane signs. A study published in the Journal of Hepatology in 2019 highlighted this connection. Researchers found that patients with liver conditions frequently reported overwhelming fatigue and a pronounced sense of physical weakness. This wasn't just a passing tiredness but a persistent state that significantly affected their day-to-day life. This revelation brings to light an important aspect of liver health. When our liver struggles, due to factors like infections, alcohol misuse, or other health conditions, it can lead to an impaired ability to detoxify the body effectively. This, in turn, may result in an accumulation of toxins, which can cause a feeling of constant tiredness or lack of energy. It's a way for your body to signal that something is amiss. So, the next time you find yourself feeling unusually fatigued or weak, especially if it's a persistent issue, it might be worth considering your liver health. Could these be subtle cues from your body, indicating that your liver needs attention? Remember, recognizing these early signs can be crucial for early intervention and better health outcomes. Next, number 2, jaundice. Moving on to the second sign, let's talk about jaundice, a term that might sound familiar, but do you know what it truly indicates about your liver health? Jaundice, characterized by a noticeable yellowing of the skin and eyes, is a direct signal from your body that your liver is struggling. This yellowing occurs due to a buildup of bilirubin, a yellow pigment that's normally processed by a healthy liver. A study in the American Journal of Medicine in 2020 examined patients with liver disorders and found that a significant number presented with jaundice. This wasn't just a cosmetic concern, it was a clear indication of an overburdened or damaged liver, unable to properly process this pigment. But why does this happen? Under normal circumstances, your liver filters out bilirubin, a byproduct of the breakdown of red blood cells, and excretes it. However, when your liver is damaged, this process gets disrupted, leading to an accumulation of bilirubin in your system. This is where the yellowing comes in. It's your body's way of waving a red flag, urging you to pay attention to your liver health. Therefore, if you notice your skin or the whites of your eyes turning yellow, it's imperative to consider it more than just a superficial change. It's a symptom demanding immediate medical attention, as it could be a sign of serious liver conditions such as hepatitis, cirrhosis, or liver cancer. Recognizing jaundice can be a key step in diagnosing and treating liver disease early, potentially saving lives. Next, number 3, abdominal pain and swelling. Abdominal pain and swelling, the third sign of potential liver damage, are symptoms not to be ignored. When your liver is in distress, it can cause discomfort and swelling in the abdominal area, particularly in the upper right side where the liver is located. This can be due to various liver conditions like hepatitis, fatty liver disease, or cirrhosis. A study published in the World Journal of Gastroenterology in 2022 highlighted the prevalence of abdominal pain in patients with liver disorders. The swelling, often referred to as ascites, is caused by fluid accumulation in the abdomen, a common complication in liver disease. It's the liver's response to injury or illness, leading to inflammation and fluid retention. If you experience persistent or severe abdominal pain and notice any swelling, it's crucial to seek medical attention. These symptoms can indicate serious liver issues and require prompt diagnosis and treatment. Remember, early detection and intervention can make a significant difference in managing liver health. Next, number 4, dark urine color. Have you ever noticed a change in the color of your urine to a darker shade? It might seem like a small detail, but did you know it could be a significant sign of liver damage? Dark urine color, often overlooked, is actually the fourth indicator that your liver might not be functioning properly. But why does liver damage cause your urine to darken? When your liver is healthy, it effectively processes and eliminates bilirubin, a yellow pigment, from your body. However, if your liver is impaired, this process is disrupted. As a result, excess bilirubin is excreted through your urine, giving it a darker color. In a study published in the Journal of Clinical and Diagnostic Research in 2021, researchers noted that patients with liver disorders frequently reported changes in urine color. It's not just a random occurrence, it's a symptom pointing towards an underlying issue with your liver. So, what should you do if you notice your urine is consistently darker than usual? It's important to consider this change, especially if it's accompanied by other symptoms like light-colored stools or jaundice. Dark urine can be a strong indicator of liver issues and should prompt a visit to a healthcare professional for a thorough evaluation. Next, number 5, pale stool color or bloody/tarry stool. Pale stool color or the presence of bloody or tarry stool is the fifth sign that could indicate liver damage. Under normal circumstances, your stool gets its characteristic brown color from bile, which is produced in the liver. However, when your liver is not functioning properly, it may not produce enough bile, leading to lighter colored stool. In a significant study published in the Journal of Gastrointestinal and Liver Diseases in 2021, researchers noted that alterations in stool color were commonly observed in patients with liver diseases. This change in stool color can serve as an early warning sign of liver issues. On the other hand, bloody or tarry stools, while less common, are particularly concerning. This can occur due to bleeding in the gastrointestinal tract, potentially linked to liver problems like cirrhosis, which can cause increased pressure in the veins of the esophagus or stomach, leading to bleeding. It's important to monitor any noticeable changes in your stool's color or consistency. Pale, bloody, or tarry stools warrant immediate medical evaluation, as they can be indicative of serious liver conditions or other gastrointestinal issues. Always consult a healthcare provider if you observe these changes to ensure timely diagnosis and appropriate treatment. And before we delve deeper into our next fascinating point, a quick note: if you've been finding this video insightful, do consider subscribing. This small act tells us we're connecting with you, crafting content that informs and resonates. Now, let's get back to our list with point number 6, chronic fatigue. Chronic fatigue, the sixth sign of potential liver damage, goes beyond the regular tiredness we all experience. It's a persistent, overwhelming sense of exhaustion that doesn't improve with rest. When your liver is compromised, it affects your whole body, including your energy levels. This happens because the liver plays a crucial role in metabolizing nutrients, detoxifying, and supporting various bodily functions. If it's not working correctly, these processes can be disrupted, leading to a constant state of fatigue. A study published in the Hepatology International Journal in 2022 provided insights into this aspect. The research showed that patients with chronic liver conditions often experience a level of fatigue that significantly impacts their daily life. This isn't just about feeling tired, it's a deeper, more debilitating exhaustion. Chronic fatigue in the context of liver health should be taken seriously. It's not simply a matter of needing more sleep or taking a day off. If you find yourself constantly tired, especially if accompanied by other symptoms like jaundice or abdominal pain, it could be a sign of underlying liver issues. Consulting with a healthcare professional is crucial to determine the cause and get appropriate treatment. Next, number 7, nausea or loss of appetite. Nausea or loss of appetite is the seventh sign that could point to liver damage. These symptoms are particularly noteworthy because the liver plays a vital role in digestion and metabolism. When it's not functioning properly, it can lead to digestive issues, including a reduced desire to eat and a feeling of sickness. A revealing study in the Journal of Clinical Gastroenterology in 2021 found that many individuals with liver disorders experience gastrointestinal symptoms like nausea and a decreased appetite. These are not just minor inconveniences, they can significantly impact nutrition and overall health. It's important to pay attention to these changes in your body. Nausea and a loss of appetite, especially if persistent, could indicate that your liver is struggling, possibly due to conditions like hepatitis or cirrhosis. While these symptoms can be caused by a range of issues, when they're coupled with other signs of liver damage, it's a strong signal to seek medical evaluation. Remember, early detection and treatment of liver issues can greatly improve health outcomes. Next, number 8, easy bruising or bleeding. Easy bruising or bleeding represents the 8th sign of potential liver damage. This symptom can be particularly alarming because the liver is instrumental in producing proteins necessary for blood clotting. When the liver is damaged, it can lead to a decrease in these clotting factors, making you more prone to bruising and bleeding. A study in the Journal of Thrombosis and Hemostasis in 2022 shed light on this phenomenon. Researchers observed that patients with liver diseases often have a reduced ability to clot blood, which manifests as easy bruising or unexplained bleeding, such as frequent nosebleeds or bleeding gums. It's crucial to take these symptoms seriously. While everyone gets the occasional bruise, experiencing them frequently or without any apparent cause, or noticing that you bleed more easily or longer than usual, could be signs of liver issues. These symptoms might indicate more serious conditions like advanced liver disease or cirrhosis. If you're experiencing easy bruising or bleeding, it's advisable to consult a healthcare provider. They can help determine if these are signs of liver damage and guide you towards the appropriate treatment. Early detection can be key in managing liver health and preventing further complications. Next, number 9, swollen legs and ankles. Swollen legs and ankles, the 9th sign, can be a significant indicator of liver damage. This swelling, known medically as edema, occurs when the liver is not functioning properly and fails to produce enough albumin, a protein that helps prevent fluid from leaking out of blood vessels. As a result, fluid accumulates in the legs and ankles. Research highlighted in the European Journal of Gastroenterology and Hepatology in 2021 found a strong correlation between liver disease and the development of edema. This swelling is particularly common in advanced liver conditions, such as cirrhosis, where the liver's ability to synthesize proteins and regulate fluid balance is severely compromised. It's important to recognize that while swollen legs and ankles can result from various causes, such as standing for long periods or high salt intake, when accompanied by other signs of liver dysfunction, they should not be ignored. This symptom can be an early warning sign of serious liver issues. If you notice persistent or unexplained swelling in your legs and ankles, especially if you have other symptoms like abdominal swelling or jaundice, seeking medical attention is crucial. Early diagnosis and management of liver problems can significantly impact the progression and treatment of liver diseases. Next, number 10, itchy skin. Itchy skin, the 10th sign on our list, can be an unexpected indicator of liver damage. This symptom, known medically as pruritus, often occurs when bile products accumulate in the skin due to a poorly functioning liver. Typically, the liver filters these substances out of the blood, but when it's damaged, this process can be disrupted, leading to itchiness. A study published in the Journal of Hepatology in 2022 found a significant association between chronic liver conditions and itchy skin. Patients with various liver diseases, such as biliary cirrhosis or hepatitis, frequently reported experiencing severe and persistent itching. It's important to note that while itchy skin can have many causes, ranging from dry skin to allergic reactions, when it's accompanied by other symptoms of liver dysfunction, it warrants further investigation. This is especially true if the itchiness is persistent, occurs without a rash, and is not relieved by typical treatments like moisturizers or antihistamines. Persistent or severe itchiness, particularly if you notice other signs like yellowing skin or changes in urine color, should prompt a visit to a healthcare professional. Identifying and treating underlying liver issues early can be crucial for managing symptoms and preventing further liver damage. Next, number 11, weight loss. Unintentional weight loss is the 11th sign that could point to liver damage. When the liver is struggling, it can impact your metabolism and digestion, leading to weight loss that isn't a result of dieting or a conscious effort to lose weight. This kind of weight loss can be especially concerning when it's rapid or severe. A 2022 study in the World Journal of Hepatology explored this connection. The researchers found that patients with chronic liver diseases, such as cirrhosis or liver cancer, often experience significant weight loss. This occurs because a damaged liver cannot effectively process nutrients and fats, leading to a decrease in body weight. It's important to distinguish this weight loss from that achieved through healthy lifestyle changes. If you're losing weight without trying, and particularly if you have other symptoms of liver damage like jaundice, abdominal pain, or fatigue, it could be a sign that your liver is not functioning properly. Unexplained weight loss should always be evaluated by a healthcare provider. It can be a symptom of a range of health issues, including liver disease, and identifying the cause is crucial for appropriate treatment and management. Next, number 12, fluid retention. Fluid retention, the 12th and final sign on our list, can be a significant indicator of liver damage. This symptom often manifests as swelling in the abdomen, a condition known as ascites, and is caused by the liver's inability to produce enough albumin, a protein that helps keep fluid in the bloodstream. When albumin levels drop, fluid can leak out of blood vessels and accumulate in body tissues. A 2021 study in the Journal of Internal Medicine highlighted the link between liver disease and fluid retention. The research showed that patients with advanced liver conditions, such as cirrhosis, commonly experience this symptom due to decreased liver function and increased pressure in the abdominal blood vessels. Fluid retention related to liver damage is more than just typical swelling from standing or sitting too long. It's often accompanied by other symptoms of liver disease, like jaundice or abdominal pain. If you notice swelling in your abdomen or legs that doesn't go away, especially if you have other liver-related symptoms, it's important to seek medical attention. Persistent or unexplained fluid retention can be a sign of serious liver issues. Early diagnosis and intervention are crucial for managing liver health and preventing further complications. A healthcare professional can provide the necessary evaluation and guidance for treatment. In conclusion, understanding and recognizing the signs of liver damage is crucial for maintaining good liver health. We've discussed various symptoms ranging from fatigue and jaundice to fluid retention and itchy skin, all of which could indicate underlying liver issues. Remember, the liver is a vital organ that plays a key role in many bodily functions, and taking care of it is essential for overall health. It's important to adopt preventive measures like maintaining a healthy diet, moderating alcohol consumption, exercising regularly, avoiding toxins, getting vaccinated, and undergoing regular health checkups. Early detection of liver problems can make a significant difference in treatment and management. If you notice any of the signs we've discussed, don't hesitate to seek medical advice. Being proactive about your liver health can help prevent serious complications and ensure a better quality of life. Thank you for watching. We hope this video has been informative and helpful. If you found this information valuable, please like, share, and subscribe for more health-related content. Remember, staying informed and vigilant is the key to a healthy life. Take care of your liver, and it will take care of you.